welcome to Session 4, Patient Co-Creation in Asia-Pacific Safe and Quality Healthcare, WHO Global Patient Safety Action Plan 2021 to 2030. We are honored to have once again as moderator Maria Fatima Lorenzo, President of the Philippine Alliance of Patient Organizations. For the session is Dr. Aparna Singh Shah, Regional Advisor for the World Health Organization, Southeast Asia. We have once again Professor Tan Kok Hian, Group Director and Senior Associate Dean of the SingHealth Duke-NUS Institute for Patient Safety and Quality, IPSQ. Also, we have Dr. Socorro Escalante, Coordinator for Essential Medicines and Health Technologies of the World Health Organization, Western Pacific. You can find their full biographies on the official Congress website. Remember, you can use the Q&A tab in the auditorium to submit your questions to the speakers. I now invite the moderator, Fatima, to the virtual floor. Over to you, Fatima.
Thank you, Cara. Our session will point out that as our healthcare has become unsafe, we must take stock of the WHO Director General when he said that patient harm has attained a public health dimension. Our speakers will be sharing insight on patient safety and how to drive the WHO Global Patient Safety Action Plan 2021 to 2030. So I am very honored and pleased to present our first speaker, Dr. Aparna Singh Shah, WHO Sierra Regional Advisor. Over to you, Dr. Aparna.
On behalf of WHO Southeast Asia Regional Office, I would like to thank organizers for giving me the opportunity to present on this platform. So I will be presenting patient safety in WHO Southeast Asia region, contributing to UHC. As you can see on the screen, you can see two cartoons. One is regional strategy for patient safety in SEER, and the other one is the recent one from WHO GP SAP. So this actually slide shows across the globe how patient safety is so important, how much damage unknowingly people are doing, which can be prevented. So this slide is about, we have recognized the importance of patient safety several years ago. WHO has been at the forefront of this initiative. You can see several committees, the resolutions, including World Health Assembly's resolutions. You can see on the screen again the regional strategy for patient safety. Patient safety is critical to the delivery of healthcare in all these settings. It aims to achieve the maximum possible reduction in avoidable harm due to unsafe healthcare. In 2006, Regional Committee 59R3, promoting patient safety in healthcare. In 2009, Regional Committee 62R6 on measures to ensure access to safe, efficacious, quality and affordable medicinal products. And in 2010, Southeast Asia region, Regional Committee 63R5, Regional Strategy on Universal Health Coverage. 2013, Regional Committee Resolution on Health Intervention and Technology Assessment and Support to UHC. In 2015, Regional Committee endorsed the regional strategy. So why I am showing you all of this? We have done a lot of work on this topic in last decade. So this is our regional strategy 2016-2025. It talks about improve the structural system to support quality and efficiency of healthcare, place patient safety at core of all levels of healthcare, assess the nature and scale of harm to patients and establish a system of reporting and learning at national level, ensure a competent and capable workforce that is aware and sensitive to patient safety, prevent and control healthcare associated infections, improve implementation of global patient safety campaigns and strengthen patient safety in all health programs, strengthen capacity for and promote patient safety research. So in our region, the state of patient safety varies not only among countries in the region, but also within the country. In this slide, you can see whether in the countries there's no plan, or there's a plan with erratic implementation due to various reasons, or very, very good plans, as you can see over the screen with major milestones, and they are implementing it year by year. So I'll start with strategic objective 1, which I have already all the strategic objectives shown in a slide some time ago. So the first one was to improve the structural system. So if I say the progress, strategies and operational guidelines to implement patient safety framework. So this is in progress, being done. Administrative structures with a mandate for healthcare quality and safety. Recognition of achievement in patient safety, which is very, very important. Now, what are the challenges for this first objective? There's a resource constraint. It includes human resources and budget in already under-resourced systems. Patient safety in primary health care, ambulatory care, including at transitions of care. Practical actions for stakeholder engagement in patient safety, quality efforts, patient communities. There are multiple vertical programs, technical streams, which needs integration and a comprehensive effort. And limited evidence base for both policy and strategy, lack of pragmatic legislation and regulation, as well as their credible enforcement. Number 2, to assess the nature and scale of adverse events. So the progress is patient safety country assessments have been carried out by most of the member states, but there is lack of actionable quality and safety data, especially at local level. For example, healthcare associated infection, surgical site infections, local anti-microbial resistance pattern. A lot of work has been done, but a lot remains. So number 3, to ensure a competent and capable workforce. Here is the catch. Here today, later in my slides, I will connect this to engagement of patient and their families. So here, but in this strategic objective, we are talking about safety of healthcare workers, number of healthcare workers, capacity building, regular training of healthcare workers. A lot of work has been done, especially in the area of maternal and child health, in point of care, quality improvement. This approach has been implemented in several countries, several places, which is quite significant, but a lot still we need to be done. So now coming to strategic objective 4, to prevent and control healthcare associated infection. So we are doing a lot of surveillance and we are doing a lot of work under HAI, but still, despite of remarkable improvement in IPC and WASH in response to pandemic, we still need to do a lot to achieve desirable results at each level of healthcare facility. This is strategic objective 5, to improve implementation of campaigns. So we are celebrating several days. For example, World Blood Donor Day, Health Hygiene Day, Patient Safety Day, We are doing a lot of advocacy for this, but there are persistent challenges. We need to still improve under Strategic Objective 6, capacity for patient safety research. So now we have 11 member states. We need to improve patient safety in all the member states. So what are things we need? We need man, that is trained human resource, mass awareness, material. We need to learn waste management. We need to learn about disinfectants, PPEs. We need to have enough methodologies, SOPs, protocols, which is also important for patients' involvement, and their family is important. How we are going to do it? We need to know the methodology, management, motivation, M&Es, maximum containment, matrix, maintenance of expertise, and above all, we need money. So we have success stories from member states. We have success stories from Sri Lanka. They have overcome a lot of resistance. They have done a lot of work because they have formed a healthcare quality safety committee. It is done by Sri Lanka Medical Association. There is involvement of professional colleges, training schools, postgraduate institutes of medicine. They're creating patient safety culture in hospitals, monitoring with clinical indicators, establishing quality management in hospitals, and they're sharing best practices, starting a postgraduate diploma in healthcare quality and safety, providing feedback and fix the system after reporting an adverse event. So now, role of WHO. So that's why I'm sitting here. So what is our role? So in our previous slide, I have already shown that WHO has been at the forefront of this initiative. We have released several documents. We are doing a lot of advocacy awareness. We are releasing a lot of training documents. There was a charter, Health Worker Safety Charter, a priority for patient safety. We are releasing strategic guidance and leadership. We are giving all the leadership required for this initiative. And we are doing a lot of collaboration and coordination with different stakeholders. COVID-19 pandemic has highlighted the importance of patient safety, helped identifying priority actions, and created an opportunity to strengthen implementation of National Patient Safety Action Plan. The release of GPSAP is very timely and will further strengthen, accelerate global and national action on patient safety. So this is mainly all these strategic objectives. I'm not sure why the first one is missing on the screen, but actually first and seventh, they are missing. At least I can't see on my screen, but you know about the objectives, you know about the details of this. So if you can see in this slide, what is patient safety actually? If I say science, patient safety is consistency and quality of care with maximum possible harm. But the philosophy is patient safety is happiness. So again, I'm going to show this number 4, patient and family engagement. Co-development of policies, program with patients, learning from patient experience, safety improvement, patient advocates and patient safety champions, patient safety incident disclosure to victims, patient involvement in implementation of action plan. For this presentation, I would like to acknowledge my colleagues from CM member states, country offices, regional office colleagues, headquarter colleagues, regional and global expert of patient safety. So thank you. Now, the last statement is from the Director General of WHO. Let's change the piece of paper into reality. Let's change GPSAP into reality. Over and thanks.
Thank you, Dr. Aparna. You highlighted the WHO has done a lot for the past decade, but I know and you have acknowledged that COVID somehow set us back and we have a lot to do. So I have some questions and I will ask this later. So thank you for your presentation, Dr. Aparna. Let us now call on Professor Tan to share, so he can share how they have progressed in Singapore. Over to you, Professor Tan.
Thank you, Maria, for your kind introduction. And I'm just happy to be able to speak here where all the patient advocates are in this conference, especially for Asia Pacific. I'll go through the aspect of patient co-creation in Asia Pacific for the purpose of safe and quality healthcare. And what just now Dr. Aparna has mentioned about the WHO Global Patient Safety Action Plan, I will deal with in detail. Next slide. So this is the Global Patient Safety Action Plan. Just now, as what Dr. Aparna have said, there are 7 strategic objectives, of which she mentioned about the patient and family engagement as also a very important objective. In here, everyone is a partner: healthcare facilities, governments, WHOs, patients, and various stakeholders are partners to bring about patient safety. Next slide, please. So these are the 7 strategic objectives, and each of the objectives has 5 sub-strategies. And basically, for WHO has launched this, and it's for us to advocate and translate this, the strategic direction, so that we can focus towards eliminating avoidable harm in healthcare for patients and families. Next slide. So for the first one, which is probably the most important, is to make zero avoidable harm to patients a state of mind and a rule of engagement in the planning and delivery of healthcare everywhere. Next slide. I think here it is important to draw from the patient's experience. So in fact, it should be a mindset change for all partners, including the patients themselves, because our mindset is to make zero avoidable harm to patients, and it's a rule of engagement within the delivery of the healthcare system. So if you are a patient advocate and you are asked, for example, to participate in a policy change, to participate in rules, to participate in legislation, it would be good to keep this mindset on hand. Next slide. What would be the benefits of co-creations in healthcare between partners like patients as well as the healthcare facilities? I think there are many examples here. I just have to quote a couple of important benefits. First, it has been shown to be able to reduce serious safety events and reduction in hospital-acquired infections. Also, to increase the efficiency of quality improvement processes. Co-creation itself actually allows the patient to have increased level of empowerment and health literacy. And also involving patients in group cost analysis actually allow us to be able to better optimize the interventions for their health care organization needs. Next slide. I'll go on to the second and the sixth strategy. The second one relating to build high reliability health systems and health organizations that protect patients daily from harm. The other one related to this is to ensure a constant flow of information and knowledge to drive this mitigation of risk and the reduction in the level of avoidable harm and improvement in safety care. Next slide. So it's important to be able to build high reliability health system, and everyone has a part to play in this, including the patients and the patient advocates. Next slide, please. So one of the aspects relating to medication safety is to be able to empower patients, families, and their carers so that they become actively involved in their own treatment and care decision, to ask questions when unsure, to spot error and effectively manage their medications. Next slide, please. So here we see a Swiss cheese model of safety where in order to prevent the error, everybody must play their part. And if you look at the various aspects, is that when the error occurs, it sometimes goes through the Swiss cheese model, goes through the whole, because there was a lot of things that went wrong, right? So here we can see resulting from the fact that there is wrong patient identification, but at the same time, the patient didn't ask or check when the patient was unsure. There's frequent interruptions, inconsistent recovery processes, leading to the doctors prescribing to the using the wrong patients from the patient list to prescribe to the wrong patient. So this is what we can see, that patients do play a part in improving the reliability of the healthcare system. Next slide, please. We go on to the third aspect, is to assure the safety of every clinical process. So what can the patient advocate do? Next slide. Well, the patient seeks help from the healthcare system for various aspects: diagnosis, treatments, rehabilitations. Error can occur because of clinical misjudgment or because of miscommunications. Next slide, please. In surgical services, wrong procedure can be carried out, wrong blood group or component can be transfused. Their patients may be acquiring serious infections because of failure to deliver the care in the proper way. Mothers and babies die from unsafe practices. And there's a lot of medication errors resulting from errors. Next slide, please. So it is important for the patients who are part of the system to understand, to be aware that there are 6 international patient safety goals that have been formulated to look at that. These are the 6 goals: identify patients correctly, improve effective communication, improve the safety of high alert medication, ensure correct site, correct procedure, correct patient surgery, reduce the risk of healthcare associated infection, and reduce the risk of patient harm. Next slide, please. So it is important to evolve to a model where patients and clinicians work in a partnership and co-create efforts to improve clinical care and safety. Clinicians be responsive to the individual patient preference, and patients play a key role in preventing the errors. Next slide, please. So here are the 3 aspects: help in detecting, reporting near misses and adverse events, take an active role in your own patient safety or in your family's own safety during the care, be involved in efforts to improve the culture of safety, because patients play a key role in this aspect. Next slide, please. So at the same time, if you have the opportunity to participate in quality assurance and improvement activities, please do so. There's quality assurance activities relating to risk mitigation, and to participate in the root cause analysis, and also to help to improve care and patients to quality improvement projects. Next. We go on to the aspect of engaging and empowering patients, families to help and support. And this has been covered by the first speaker. Next slide. All I want to mention is that be a patient partner for improving care in the community. Be comfortable in asking questions, participate actively, and share success stories. Next slide, please. So in SingHealth, we have a very active patient advocacy network. And actually, because of them, a lot of good things has come out in order for us to be able to help to reduce errors and to improve patient safety. Next slide, please. I think these are some of the activities that they have done, quite projects, speaking engagement, judging panel, training and focus group, many activities they have done for the healthcare cluster to improve patient safety. Next slide, please. Some of the engagement toolkits with patients and families, telling how, for example, how the healthcare staff can engage patients and families for healthcare improvement. Next slide. Videos to educate patients and also healthcare professionals. Next slide. And also drive patient advocacy training. So our group itself, the SingHealth, in SingHealth, the SPAN members actually have a onboarding training. And this is a quite effective advocacy communication training that they want to share with many people actually beyond SingHealth as well. Next slide, please. We go into the aspect about inspire, educate, skill up, and protect healthcare workers to contribute to the design and delivery of healthcare system. Next slide. And our SPAN members has been very supportive, even creating a video to thank all of us personally to be able to improve the care. Next slide, please. And very importantly, to be able to develop and sustain multi-sectoral and multinational synergy and partnership to improve care. This is the last strategy, WHO program. Next slide. And here we need to build a collaborative ecosystem. So I'm very happy here to be part of this global effort for patients and families to be engaged as partner in safe care. COVID-19 brought increased recognition, and we have to work harder to make care safer for everyone and the healthcare system more resilient. Next slide, please. It's also important for patients to be involved in research, and there are many aspects you can help out as participants in the design of study, defining the need as a review of study, and to provide outcome measurements. For example, patient-reported experience measures and patient-reported outcome measures. Next slide, please. And finally, I just end a couple of slides about the global actions for leaders and learning organization on patient safety. This is an aspect that we hope, next slide, please. We hope would for all organizations to be able to share their best practices and working together to help to improve safety outcome. Next slide, please. So this is to enhance awareness and work towards developing good strategies and effective contextualized implementation of needed areas. And finally, a slide I just want to share with you. Next slide, please. It is that it is important for practice-based evidence to pilot practice so that you can generate evidence. And this evidence will go on to be part of the virtuous cycle for improving patient safety and quality. And at the same time, to influence another site, another country, and contextualize and adopt it so that another site can benefit. So thank you very much for your attention. Next slide.
Thank you so much, Professor Tan.
Thank you. Thank you.
Thank you. The putting together your Singapore Patient Activity Network SPAN is something to emulate, and we here in the Philippines will like to learn more about this and how that was developed, how that was co-created. So thank you, Professor Tan. And now we will call on Dr. Socorro Escalante, Coordinator for Essential Medicines and Health Technology, WHO Western Pacific. Dr. Socorro, the floor is yours. Thank you.
Thank you so much, Maria Fatima, and thank you so much to the Asia Pacific Patients Congress for inviting WHO to present our work on patient safety in the Western Pacific region. Next slide, please. So in my presentation, I'm going to speak about the areas where the Pacific Regional Office work. Next. So just going through the outline of my presentation, I speak a little bit on the global safe gain, even if this has already spoken to by my colleague Aparna from the CRO. And then I will give also on how patients in the work of on our program on safety of medical safety and antimicrobial resistance. So next slide. A little bit in the addition of this slide, so please bear with me. So just to contextualize, the presentation, I would like to start with the definition of patient safety, because this is really very, very important for us to take into context. So patient safety, as we all know, is a framework of organized activities that creates cultures, processes, procedures, behavior, technologies, and environments in healthcare that consistently and sustainably lower the risks, reduce the occurrence of avoidable harm, make errors less likely, and reduce the impact of harm when it does occur. So with this definition of patient safety, the work in WHO Pacific is looking at how we are going to embed the culture, improve the processes and procedures in country, provide their service delivery mechanisms, and also influence change of behavior while improving technologies and influencing our environments. Next slide, please. So I think I'm not going to go through this slide anymore, but this is about the the Global Patient Safety Action Plan. And just to repeat that the framework has several dimensions. Number one is for policies to eliminate avoidable harm. Second is institutionalizing or setting up high reliability in health systems, safety of clinical processes, patient and family engagement, health worker education, skills and safety, and information, research and risk management, and of course, stimulating synergy and solidarity. Next slide, please. Next slide. So I will start to describe how we work in a Western Pacific region on patient safety by articulating our overarching policy, and that is the universal health coverage moving towards better health action framework for the Western Pacific region. So the principle beyond this policy is to have in countries strong health systems that is based on the values of primary health care and focused on the vision of providing universal health coverage for quality health services that can be efficient and effective way to contribute to improve and equitable health outcomes. So for those to be achieved, we have designed or defined what could be our attributes of health systems to ensure universal health coverage. And that number one of this is quality. A second is efficiency. Third is equity. Fourth is accountability. And fifth is sustainability and resilience. You would see particularly how the quality parameters or the action domains are defined. And that includes regulations and regulatory environment, effective and responsive individual and population-based services, individual and family and community engagement. And then if we are going to go to the efficiency, this is about health system architecture to meet the population needs, incentives for appropriate provision and use of services, and managerial efficiency and effectiveness. In particular, these two attributes of the health systems will encompass the definition and goals of patient safety, quality, as well as patient engagement to ensure the achievement of safe environments for all the services that will be delivered in countries. Next slide, please. And going through again under this framework of the universal health coverage, it is very much based or contextualized on producing outcomes. And you would see there the number one outcome and impact that this framework aims to achieve is reduced health risk and improve health. Next slide. From the overarching policy of the universal health coverage that incorporates quality and safety dimensions, we now carry on to incorporate the principles of safety in the other programs of WHO. And one of these is the safety in medical products. So WHO works with partners, national regulatory authorities, and member states to ensure safety, efficacy, and quality of medicines and medical products. As you know, the work of WHO is focused on development of scientific and technical guidance, as well as norms and standards on quality and safety of medicines, from research and development to manufacture, production, and use. So WHO as well have established mechanisms to ensure safety, quality, and efficacy of novel products in public health emergencies, the critical importance of which has been demonstrated during COVID-19. And lastly, the development of diagnostic, therapeutics, vaccines, and health technologies during COVID-19 has been made possible through the decades of work of WHO on norms and standards on medical products. Again, emphasizing that the work on WHO on developing norms and standards of medical products is to have highest outcome of protecting the safety of the patient and of and public welfare as well. Next slide, please. So how do we look at the safety in medical products, and how do we ensure that countries will be working towards that? In 2018, WHO's the regional committee endorsed the framework for regulatory strengthening, cooperation, and convergence. And this aims to raise the level of regulations of medicines, vaccines, and other medical products in the whole region to safeguard safety and welfare of the people. If you are going to look at the right side, and this is the framework, the frame of our interventions, we provide support to all member states to ensure that during the entry of the medical products in their countries, the national regulatory authority can set the standards for the entry of products that is based on standards on safety and quality, that they are able to undertake registration and able to evaluate the quality and safety and effectiveness of products based on evidence. They undergo licensing for medical establishments, and they have to monitor the entry of all products in the country. Once the products are registered, we support countries to continue undertake quality assurance, particularly in monitoring compliance of basic regulations, such as, for example, the manufacturing of medicines or distribution practices of medicines, and monitoring substandard and falsified medicines in the market. And we also provide mechanisms to strengthen national regulatory authorities to manage non-compliance, such as, for example, recall and withdrawal of the product, and to safeguard regulatory failures. Next slide, please. Another area or dimension of WHO's work in the West to ensure safety is on service delivery. So in 2020, the Regional Committee for the Western Pacific has endorsed the action framework for safe and affordable surgery in the Western Pacific region. And this framework ensures, number one, access and availability of surgical services, the safe and timely surgical care, the availability of skilled workforce or the development of skilled workforce and competent workforce, the availability again of medicines and surgical commodities, equipment and infrastructure, affordability of these services, and that the country and regional initiatives to achieve universal safe coverage of safe and affordable surgery must be carried out in all countries. Next slide, please. And lastly, but not the least, I would like to particularly pitch the issue of antimicrobial resistance. So WHO has been prioritizing antimicrobial resistance to protect the health and safety of the people in the Western Pacific region from avoidable harm. AMR is a silent that affects patients and individuals every day. So we see AMR as a security and development And we have been looking at going to manage antimicrobial resistance. AMR. If you're going to see the graph, the first we have the candidate AMR. Actually cannot, because so long as the or organisms, and so long as for organisms to change and to mutate and to become resistant to antibiotics. So if you are going to look at the right side, our strategy therefore is not towards the elimination of antimicrobial resistance, but to go ahead of the curve of the antimicrobial and reduce well-being individuals at a sustainable manner. This slide the next slide. Hello, can next slide? So with the visiting that context, we developed the framework for accelerating actions to combat antimicrobial resistance. The principle of the health and safety of the people from avoidable harm, that is antimicrobial resistance. So we'll see here that AMR is characterized by, it is something that will continue in the future. It affects everyone at all ages in every country. It is infinite. It will to do this, we have developed strategies that, since it is future, our strategies need to be future oriented. Since it affects all, we need to aim for a movement that everyone is responsible for protecting itself, the family, and the society. And since it is infinite, we need to ensure that our interventions are sustainable. So we need to use sustainable systems that are already in place. And since it is contextual, we need to focus on the factors that impact MR at the local, but also ensuring that we have local intelligence. We have information on the practices and the drivers of AMR. And by that, we could mitigate AMR through a One Health approach at the local and at the national level. Next slide, please. So we engage everyone in the fights against antimicrobial resistance, and we have started this campaign in 2017. We call it Stewards for the Future, because everyone patient is a steward for the future, and we have to join together as one region and one movement to fight antimicrobial resistance. So in closing, it would take individual families, institutions, communities, countries, not only to fight antimicrobial resistance, but to ensure a safety for everyone. This is a shared value that we need to share to each other and to the federation. To undertake this is to create movements, communities, national, regional, international level. I'm still one, and if you could please move to the next slide. That's my last one. So this is my last slide. This is the campaign website for Stewards for the Future movement. And I would also that this week is the World Anti-Microbial this region against antimicrobial resistance, which is so with that, I for the unstable very smoothly, but thank you so much in the West region.
Thank you, Dr. Socorro. I will see you on Thursday. PAPO will be part of the AMR, and I've already signed the pledge for AMR. So thank you so much. So we shall have some panel discussion. We will now go into the panel discussion. And there are some questions here that I'd like to ask. Dr. Aparna, you said that there's some challenges of bringing down the policies of patient safety to the local level. So what are some, can you give us like top three strategies, if you were to choose top three strategies of bringing down these policies in the local level, what would this be?
Thank you, Fatima. This is a very, very, good question, and without this we cannot actually implement it fully, irrespective of endorsing document. Your question, answer to your question is very important. So what I think is the first thing would be advocacy and awareness. So when we think advocacy and awareness, we only think about patients, we only think about the community who are not very educated, but I'm not with it. I always think that it starts with the policymakers. It starts with the policymakers, and it starts with the national action plan. There could be a global action plan, there could be a regional action plan, but then in the country, if you have a country action plan, then there are several levels who are there to implement that plan. And there is a plan, there is a strategy, there is an implementation plan, and there are indicators for monitoring and evaluation. So we need to clearly set timelines that, okay, this is the goal, this goal will be achieved in this duration, and then the next thing. Country needs to prioritize. There are, in the 7 strategic objective, there are several strategies. So it's a big thing. So they cannot swallow it all, in one go. So they need to see what is most relevant in their context. They need to select, and then in their national action plan, they need to revisit it. And then they need to also strengthen their legislations, regulations, not only on paper, they need to implement those. And then with M&E and with a good plan, I'm sure it can be done. In brief, over.
Yes, thank you. So I think the key there is the monitoring and evaluation. That if it has been done, if something is being done regularly, like a periodic reporting of what has been accomplished. Would Professor Tan, would you like to answer also the question?
Yeah, thank you for the question. I think it is important to be able to monitor. And currently, in fact, tonight, the WHO will be meeting, and I'm one of the person included, about how we can actually decide on what are the indicators to actually measure, and how to measure them, and how to report them. It is not easy. And also, as just now what Dr. Aparna has said, different countries are good in certain things and not so good at certain things. So which is why for our Gallup program, for our leadership program, where we invite healthcare leaders from Asia to come in, we ask them to look at all the 7 strategies and the sub-strategies and find out for themselves, decide for themselves what they are strong at after they have listened to the rest, and what they are weak at after listening to the rest. And then maybe they can share their strong practices and boost up their weak practices as well. The WHO has also certain indicators whether it has been done. For example, whether you have a framework for reporting. So that indicator itself, it can be a good marker of how many of your hospitals have actually adopted that itself. So there are many indicators. So it is, in fact, it's going to be a one whole workshop session just to discuss about that. So I think we can do it. And I think with the help of everyone here, of the whole world, we should be able to come out with something that perhaps we can move together along, helping each other along the way towards better patient safety.
Thank you, Professor. Dr. Socorro, would you like to share your thoughts on the question?
Yes, thank you so much, Maria Fatima. The way that we approach in the Western Pacific region are two things. One is being very much aware of the country context upon which the systems can be built to produce a safe outcome for all health services. And we have always been taking this the systems approach way of supporting our member states. So if I'm going to give you a very concrete example, the safe and affordable surgery is one example by which we look at what are the outcomes, what would the people need in terms of safe and affordable surgery. And based on what are the outcomes that the countries envisions, or what are the needs of their population, we help them and we guide them to build systems. For example, the systems in the Pacific island countries will not be the same as the systems that Philippines or Singapore or Vietnam or China would have. However, there are very, very basic principles that all the countries would need to follow, such as what are the essential and basic steps for safety. And then from there, we build what is possible in their own context. So for example, in the Pacific Island countries, we do not have trained surgeons. We do not have big hospitals. Patients are sometimes referred to Australia or to Singapore. So with this, if we want to deliver safe and affordable surgery in the future, we start to build now what we need to do in the Pacific. And that starts, for example, looking at what would be the human resources that we need in the future for safe and affordable surgery in the Pacific. And we look at their educational system. What are the possible training available that we could take advantage so that in 5 years we could produce competent surgeons or competent nurses or competent anesthesiologists that could handle safe and affordable surgery. Second, what would be the basic essential elements of a surgical infrastructure, and that could be accessible to the Pacific? So I could go on and on, but this is how we are approaching the safe and affordable surgery. And as my colleague Aparna has mentioned, the monitoring and evaluation on the progress of the systems building and the outputs along the way is always an important component for the WHO to sustain the continuous development of systems for safe and affordable surgery in all countries in the Western Pacific region.
Yes. Thank you, Dr. Socorro. So it's really prioritizing and looking at your resources and seeing what can be done with what you have, correct? Yes. So, Professor Tan, you focused on family and community engagement. So, especially with SPAM. So, if for us patients, if we were to start something like this, how would we do it? How will we start it?
Well, thanks for the question. In Asia, it's a bit difficult to start for some of the countries because of the concept, where doctors knows best, the healthcare workers. So a lot of our patients and patient families are reluctant to actually come forward to be part of the partnership in care itself. So it takes a little bit of persuasion. But of course, everything starts with a small step, right? So we can always try. For example, in SingHealth, we actually try because it's also new to us. We've been in Asian countries, India, Malay, and Chinese. We are not used to countries. So we actually start small. We thought that we get it from all the support groups coming together and share common themes itself. And then we get them to be involved at more than just giving feedbacks. That means patient advocacy is not just about giving feedbacks, but actually being more involved. So we get them involved in our quality improvement committees, and we let them decide. And soon after that, there's leadership within the group itself. And of course, the hospitals will have to support them very strongly itself. So once they are supported and you have good leaders within the members itself, which is why it's very important here for this meeting that perhaps some of the patients here will take up leadership within their various aspects and maybe drive that itself, because we realize that it has to be a spontaneous. They are not there just to please the healthcare workers. They are there to partner with the healthcare workers as well. And they come up with so many projects that I simply was blown away. I was so impressed. So it actually has a momentum of its own. So I would urge perhaps all of us should give it a try within our countries. I know some of the countries may be more advanced, but some hospitals, they really don't have that, and we should encourage that.
Thank you, Professor Tan. For our last 5 minutes, maybe Dr. Aparna, how can you encourage us, patient leaders, to be involved in patient safety? And I will also ask the same question to Dr. Socorro.
What I think is in our member states, mostly the education level is not very high. There are many people who are not very educated. They do not know actually that they can contribute. They do not know that they have a voice. They do not know that, they can even talk to the doctor and say, this is correct, this is not correct. And sometimes they are hesitant to ask doctor about the procedure. And, they just keep quiet. They just think that, okay, I'm talking about the rural, it's not, not the tertiary centers maybe, but most of the places, they're scared to kind of, speak, and because they feel that doctor will not be very happy. As a doctor, I know it, because as a physician, I would know. So I'm saying sometimes, they're very, very hesitant to talk to them, because they feel if they will say something, they might get angry, and then maybe the procedure will not be that okay. So the role of the champions could be bridging the gap between the two parties. See, doctors are extremely busy. We have very less number of healthcare workers if you compare them with number of patients. So every minute, every doctor in the tertiary to low healthcare levels, they need to see every minute several patients. They do not have so much of time, if they need to entertain everybody. So they need to give very little time. So then here comes the role of the champions, because they have more time with the patients, and then separately they can speak with the healthcare providers, and then they can bridge the gap, so that gradually, it will start building. And I think one day it will be good enough to bridge the whole gap. Over.
Thank you, Dr. Aparna. Dr. Socorro, in one sentence, how will you encourage patient leaders to have an active role in patient safety?
Maria, Fatima, I'm not sure I could say it in one sentence. If you could allow me to say a paragraph. But first and foremost, I will contribute the points which I believe patient groups could contribute, but also coming from the realities of our work and understanding the context of our countries. Like, as I've said, we have very developed countries where all the things that we are saying here could be possible. But I and you and many of us have worked in really difficult situations that even, for example, gloves is not available for the healthcare worker. And these are water and sanitation, for example. And these are very basic, fundamental for patient safety. So with that context, I would like to think that first, awareness. It's very important for our individuals and patient groups to be aware of the possibility and risk for harm, that even in the context of healthcare settings, harm can happen. And having that awareness, they will be more careful in, as Aparna said, communicating and engaging with their doctors. Number two, is to be aware of their rights, that they have the right to question, they have the right to raise issues to their healthcare worker professionals. And lastly, is to influence their leaders, local politicians, to ensure that their hospitals and health facilities are safe, that they have to invest in infrastructure, and that they have to invest in creating a safe environment for the patients. So I'm sorry it's not one sentence, but thank you so much for the opportunity.
Dr. Socorro. So to wrap up our session, all of us have a role and we need to be empowered to push patient safety forward. Thank you so much to our dear panelists and our speakers. Thank you.